some of the more recent commentary that you've been making, Albert, and thank you for being here with us today.
Thank you for
Appreciate
having me
it. So you have talked about that a fourth booster dose might be needed. You've also talked about the company's efforts to develop vaccines that target a range of variants, right? Just kind of looking at the chatter this morning and also looking at the booster uptake, which is definitely not nearly as high as for the original shots. Definitely not nearly as high as for the original shots. How do you overcome that? How do you overcome sort of not just vaccine hesitancy, but booster fatigue, if you will?
I think we need to come with a vaccine that it is lasting at least a year. And all our research programs are aiming right now at that. A vaccine that will last a year and that will cover all known variants, Omicron and the old ones.
Sadly, the virus itself, particularly the variant called Omicron, is a type of vaccine. That is, it creates both B-cell and T-cell immunity.
But
and
Omicron is the one that it is very, very key here. So we are progressing with this so that we can bring it to the world. But in the meantime, people need to follow the recommendations of the health authorities. Those that they will have way better chances not to get into trouble.
There are two concerns here, is that if we have a strategy in which we give boosters, let's say, every 4 months approximately, we will end up potentially having problem with the immune response, and the immune response may end up not being as good as we would like it to be. So we should be careful in not overloading the immune system with repeated immunization. And
out of the hospital.
Diving deeper, the study also found protection faded more in preventing trips to the doctor or emergency departments, falling from 87% in the first 2 months to 66% after 4 months. After more than 5 months, vaccine effectiveness fell to roughly 31%.
Data shows that among 12 to 17-year-olds, protection against hospitalization offered by being fully vaccinated dropped as much as 21% after the 5-month mark.
There is a program to see if there is a need of a fourth booster or not, based on real-world data that we have compiled, and those will be assessed by FDA pretty soon. We will submit pretty soon, and then they will have to make the recommendation, approval and recommendation, FDA and CDC. There is the program that we are developing, a vaccine, new version of our vaccine that covers both the old variants and Omicron, at least twice as good as the previous one.
Are Americans really going to be willing to get a second booster or a fourth shot?
I think we've seen problems with people getting their first boosters. I mean, we only have 50% of eligible people boosted right now, and that's
We are continuing to assess data on the effectiveness of COVID-19 vaccines and treatments against Omicron and its subvariants of concern. In the face of rising infection rates, it is important to stress that vaccination continues to offer high protection against hospitalization and death due to COVID-19, despite, according to some studies at least, some reduction of protection from severe disease is occurring over time. For this reason, we continue to urge all citizens to get vaccinated and for those eligible to get a booster shot as well.
People need to follow the recommendations of the health authorities and not to get into trouble.
No country can boost its way out of the pandemic.